We're here to protest the PEIA 2011 plan to cut our benefits and increase our out-of-pocket costs, increase our deductible costs, and increase our co-pays and dependent coverage pays, which will amount to, for family, a pay cut of up to $5,000 per person. It's unacceptable while our pay is frozen.
Can I join more than one union?
You sure can.
I'm already in after me. Of course, everything should be in person.
Huh? We should have brought the megaphone and did some.
No more pay cuts. No more pay cuts.
You know.
No more pay cuts. Stop picking our pockets. John.
Catch the buckets.
No more pay cuts. 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 Stop picking our pockets. Stop picking our pockets. Stop picking our pockets. Stop picking our pockets.
Thank you all for coming out here this evening. Good to be back again. Another year it seems to flew by. Just so I know I'm talking to again tonight, could I ask please, how many state active employees do we have? Super good, thank you. How many retirees do we have? Very good.
Good evening. My name is Stephen Thompson. I am the Chief Steward and President of the Capital Chapter of West Virginia Public Workers Union, UE Local 170. This national trend, resulting in a 29% increase in healthcare spending, is not because agencies like PEIA are providing 29% more health care. In fact, we just found out they're planning to cut healthcare benefits 5%. Instead, this 29% increase in health costs is directly related to the profit margins of third-party administrative service providers, pharmaceutical company, and hospital corporations' greed. These healthcare cost increases are being passed on to working people all across America because of the failed personnel management practices that put CEO pay raises first ahead of taking care of working people. And we agree. PEIA can save a lot of money by working to reduce preventable illness. But the PEIA Finance Board is failing to properly manage program costs, and PEIA is instead simply picking workers' pockets by operating PEIA like a company union, paying public workers in PEIA company script, and providing benefits only at the PEIA company store where the prices increase while the benefits, services, and the real wages are cut. PEIA can do a better job at personnel management to save the state money and improve public workers' health. For example, Secretary Ferguson and Joe Smith could be supporting the West Virginia Public Workers Union recommendation for the state to fund and hire the staff necessary to implement meaningful occupational safety and health standards and to enforce compliance with the West Virginia Occupational Safety and Health Act. The lack of meaningful OSHA implementation and no West Virginia OSHA compliance has been making public workers sick for 22 years. West Virginia public workers are among the lowest paid public employees in the nation, resulting in statewide job vacancies, mandatory forced overtime, and arbitrary work schedules that deny public workers what should be overtime opportunities, and that is making our people sick. Arbitrary sick leave policies imposed by agencies that violate the rights of public workers are making us sick. The pay freeze being enforced by PEIA Finance Board member Joe Smith is most certainly making public workers sick. The law firm that employs the PEIA Finance Board representing public employees is making public workers sick by sponsoring anti-employee and union-busting training seminars which are being attended by state government agency human resource managers. Management harassment, reprisals, and retaliation against people who file and participate in grievances is making public workers sick. If the personnel management specialists on the PEIA Finance Board will not encourage efficiencies accountability in state agencies, PEIA could at least negotiate better corporate contracts. The PEIA Finance Board Chairman also served as Chairman of the Pharmaceutical Cost Management Council. Instead of saving the state money by helping to control the corporate greed of the pharmaceutical industry, the council spent over $1 million on cushy administrative salaries and only managed to save the state about $300,000 according to a 2008 legislative audit. Meanwhile, according to CNNmoney.com, the 12 largest pharmaceutical industry giants made over $65 billion in profits in 2008, which is slightly 12.1% more than they made in 2007. Medicare Advantage, a PEI third-party administrator, underreported their profits by more than $1 billion according to a recent GAO report. PEI third-party administrator Wells Fargo is paid over $500,000 by PEI every month just for administrative service fees. Before the privatization of this administrative staff function, these administrative services were once done by public workers for a fraction of this overhead cost. In the first 9 months of 2009, Wells Fargo has earned over $9 billion in profits. The only way public workers are going to be treated fairly when confronted by this kind of failed personnel management system is to organize together and take collective action to protect our rights and to protect our benefits from this kind of a PEIA company store-imposed pay cut. The benefits in West Virginia for public workers have always been the trade-off. The part of the pay plan, because the pay is so low, you have good benefits. This 2011 pay plan, PEI plan proposal is a pay cut because of the failed personnel management system of this state. We do have something that we can do. We have a petition for a $1,000 pay raise across the board for every person, retired public employee. That's fair. According to the state tax department, the $168 million surplus over the past 2 years was earned by public workers because of the statewide staff shortage. A fair across-the-board $1,000 raise for public workers and retirees will cost $68 million, which just happens to be the leftover amount of the budget surplus after the projected $100 million deficit. There are $68 million of the budget surplus left sitting in the bank right now. So there's no reason the state can't afford an across-the-board pay raise of $1,000 for every public worker and retiree retroactive to July 1st, 2009. The West Virginia Public Workers Union does not accept a pay cut imposed on public workers by an unaccountable PEI finance board, and public workers all across West Virginia have earned and deserve a fair pay raise. Now, just out of curiosity, I'd like to see a show of hands of all the people in the room that got a $5,000 pay raise or more in the last year or two. That many. So for all of you, this is a pay cut. We know we deserve more than a $1,000 pay raise, but the remaining $68 million balance of the budget surplus is already earned and sitting in the bank. It is time to give this modest but fair $1,000 across-the-board pay raise to all public workers and retirees. I'd like to see a show of hands of all the people in the audience who think public workers and retirees deserve at least a $1,000 across-the-board cost of living pay increase, not a PEI Finance Board proposed pay cut. That would be me too. Thank you very much. Thank you all.
I'm speaking for the people that can't come here tonight, okay? And I'm speaking for the person that maybe feels like they can't speak, okay? And what we're saying is, do not raise our health insurance premiums, because most state workers work hard. They come to work every day, and while you're out on the golf course or in some meeting somewhere, they're at their desk or at their cubicle working their tails off. For what? They were offered a $500 bonus and the governor snatched it off the table. You know what? That's a tragedy in itself.
I work with people that make $13,000 to $16,000 a year. Most of these people are having to work 2 jobs. They're trying to raise families. I'm sure that if they had the time and the energy to cook nice, healthy meals, if they could afford a good, lean piece of meat. But everything has to be fast. Oh, Mr. Cheatham, You are cold. You are a cold man. I've watched I'm a people watcher. I'd like to see who's been doodling, because I haven't seen very much eye contact at all with the audience. And you should keep your head down. You really should. I'm from Southern West Virginia, and teachers, I do apologize to you, but I am a Southern West Virginian. And we have always tried to take care of people. People from out of state loved to come to West Virginia because they said they were the friendliest, most helpful people in the world. I read this, you know, the governor sent all the state employees, you know, buddy, that he mentioned back tax. The last sentence is, again, I want to thank you for all your hard work and commitment to the state of West Virginia. Our continued success depends on you. Please keep up the good work so people can get $5,000 raises. And then we have to suffer for it. That is cold, Mr. Chief. That is very cold.
Let's be real clear that what's happening here is not an attack on obesity or lifestyles. It's an attack on West Virginia workers. And it's an attack as part of the general United States-wide attack on working people. We're basically becoming superfluous. They don't need us anymore. My job could be outsourced tomorrow to Pakistan or someplace. It's part of a general attack that I think the Manchin administration and the people who are going to follow behind them have to outsource, to get this out of the government. They want to do away with our benefits. And make no mistake, you know, when you do away with the smoke and mirrors, the actuarials and all the rest of it, I feel a hand in my pocket. And we know whose hand that is. It's the Manchin administration. And I'm telling you, Governor Joe, if you want to put your hand in my pocket, I don't allow many people to do that. But if you want to do it, then make sure you're making a deposit and not a withdrawal.
Mr. Cheatham, Dr. Ferguson, I don't see how in the name of God that you people can actually bring forth a proposal to take pay away from hard-working men and women that make this state operate. When there's programs and there's ways out of it, there's ways that you can get the money funded through the government. All you got to do is talk to them fat cats up there and get them to do something. Go to the legislature. Just like the government that balanced the budget on the backs of state workers, now you come along kick us in the hind end again. I'm a highway worker. And we work long, hard hours. But we can only do what the government will let us do. But here in the last several years, I've seen a lot of young folks come on board. People are trying to get a foothold in West Virginia and trying to raise a family. But it's the truth, the leadership of this state is what's driving them out of state into other bigger and better jobs. They're always whining they can't retain people. Why are people leaving West Virginia? Well, it's no wonder. Why would they stay here? To live in poverty and work for this state? And have the bureaucrats steal money from you and pick your pockets every time you turn around? Why? Do we call it corporate greed? It's the leadership of this state and the agencies within this state that have failed us. And they continue to fail us as they take away our benefits and make most of us live on the verge of poverty. If I were speaking on